When seniors travel, their primary concerns are often relaxation, enjoyment, and cultural exploration. However, after the age of 70, political instability in a destination becomes a much greater threat than many realize. Political instability refers to situations where a country is experiencing unrest, frequent protests, violent clashes, terrorism, or even armed conflict. For older adults, such conditions magnify the risks due to their reduced physical strength, slower mobility, and higher dependency on safe, stable environments. Firstly, political instability often leads to sudden and unpredictable violence. Many parts of the world, demonstrations that may start peacefully can quickly turn into riots with tear gas, gunfire, or stampedes. For a healthy young traveler, escaping a tense situation might be manageable, but for someone over 70, running, climbing, or quickly navigating crowded streets is nearly impossible. Seniors are more vulnerable to getting trapped in dangerous situations, which can easily result in injury or worse. Secondly, unstable political climates often cause breakdowns in essential services such as healthcare, transportation, and security. Hospitals may be overwhelmed with casualties or lack basic medical supplies during political crises. For an elderly traveler who might already depend on medications for blood pressure, diabetes, or heart disease, this can become life-threatening. Even something as simple as accessing safe food and water may become challenging in countries undergoing unrest. Third, countries experiencing political instability are more likely to have weak law enforcement or corrupt systems. This makes tourists, particularly older ones, prime targets for scams, theft, and even kidnappings. Criminals often view seniors as easy targets because they move slower, carry valuables like cash or passports, and may not react quickly in threatening situations. This puts older travelers in constant danger, especially in regions where legal systems cannot guarantee protection. Additionally, political unrest can cause travel disruptions, such as flight cancellations, road blockages, and sudden curfews. Seniors often rely on predictable schedules and accessible transport, and any disruption can cause severe stress, confusion, and even health emergencies. Being stranded in a foreign country without access to proper accommodation, medical facilities, or safe transportation can create dangerous circumstances for older travelers. Finally, the psychological toll of traveling to politically unstable countries should not be underestimated. Seniors value peace, calmness, and safety when they travel. Being exposed to violent protests, heavy military presence, or tense political environments creates unnecessary anxiety and mental strain. At an older age, stress alone can worsen existing health conditions like hypertension or heart disease. As we age, healthcare becomes one of the most critical aspects of daily life. For seniors over 70, the body is more fragile, chronic illnesses are more common, and even minor health issues can escalate quickly. When traveling, the availability and quality of healthcare are not just conveniences, they are necessities. Visiting countries with poor or unreliable healthcare systems can pose severe, even fatal, risks for older adults. Firstly, older travelers are more likely to face sudden medical emergencies. Heart attacks, strokes, falls, or breathing difficulties can occur without warning. In a country with advanced healthcare systems, emergency response is quick, and hospitals are equipped with life-saving technology. But in nations with underdeveloped healthcare, reaching a hospital may take hours, and once there, facilities might lack proper equipment, trained staff, or even electricity to power critical machines. For someone over 70, this delay can mean the difference between recovery and tragedy. Secondly, the availability of prescription medication is often overlooked. Seniors usually travel with daily medicines for blood pressure, cholesterol, arthritis, or diabetes. In countries with weak healthcare systems, pharmacies may not stock these medications consistently or may sell unsafe counterfeit drugs. If an older traveler loses their supply or needs more, finding replacements in such destinations can be nearly impossible. Missing just a few doses of essential medicines can quickly destabilize health in older age. Third, infectious diseases become a greater concern where healthcare infrastructure is weak. In some developing countries, sanitation is poor, clean water is scarce, and vaccines or antibiotics may not be widely available. Seniors already have weaker immune systems, meaning they are more vulnerable to illnesses like food poisoning, malaria, dengue, or influenza. Without access to prompt treatment, what might be a manageable illness for younger travelers could become life-threatening for older adults. Moreover, language barriers combined with poor healthcare systems add another layer of danger. In some countries, doctors may not speak English or have the cultural training to communicate effectively with foreign patients. This can lead to misunderstandings about symptoms, incorrect diagnoses, or inappropriate treatments. Seniors, who may already feel anxious or confused in medical emergencies, are at an even greater disadvantage when proper healthcare communication is absent. Another factor to consider is medical evacuation. In countries with poor healthcare, serious emergencies may require airlifting to another nation for treatment. For seniors, this is not only extremely costly, sometimes exceeding tens of thousands of dollars, but also highly stressful and dangerous during the evacuation process. Older bodies are less resilient to long, stressful journeys, especially while unwell. Finally, traveling to countries without reliable healthcare robs seniors of peace of mind. Instead of enjoying cultural experiences, they may feel anxious about what if something happens. This constant worry can take a toll on their mental and physical health, making travel more of a risk than a joy. Traveling after 70 should be about comfort, safety, and enjoyment, but extreme climates can turn a pleasant trip into a health hazard. As the body ages, it becomes less capable of adapting to harsh weather conditions, such as intense heat, freezing cold, high humidity, or thin air at high altitudes. These extremes place heavy stress on vital organs, which for seniors can lead to exhaustion, illness, or even life-threatening events. Firstly, extreme heat poses one of the greatest risks for older travelers. Seniors are more prone to dehydration because the body's ability to conserve water diminishes with age, and the sense of thirst weakens. Spending time in hot, humid countries can quickly lead to heat exhaustion or heat stroke. For those with pre-existing conditions like heart disease or high blood pressure, high temperatures can worsen symptoms, strain the cardiovascular system, and increase the risk of heart attacks. Air conditioning, which may be limited in some regions, is essential for protecting seniors in hot climates. Secondly, very cold environments create a different set of dangers. As people age, circulation weakens, and body fat decreases, making it harder to stay warm. Seniors are more vulnerable to hypothermia and frostbite in freezing countries, especially if heating systems are inadequate. Cold weather also worsens joint pain from arthritis, increases blood pressure, and can trigger heart problems. Simple activities such as walking on icy streets also carry higher risks of falls and fractures, which can be devastating for someone over 70. Third, high-altitude destinations such as mountain regions can be particularly dangerous. At high altitudes, the air is thinner and contains less oxygen, which puts stress on the lungs and heart. Younger travelers may feel mild altitude sickness, but for seniors with existing heart or respiratory conditions, the risks are much greater. Shortness of breath, dizziness, or chest pain can escalate quickly, especially in countries without immediate medical access. Humidity also creates unique challenges for older bodies. In highly humid places, sweat does not evaporate easily, making it harder for the body to cool down. This increases the risk of overheating and dehydration. At the same time, humid environments can worsen respiratory issues such as asthma or chronic bronchitis, which are more common in older age. Additionally, bacteria and fungi thrive in damp climates, raising the risk of infections that seniors' weaker immune systems may struggle to fight. Extreme weather events such as hurricanes, sandstorms, or blizzards add another layer of unpredictability. Seniors may not have the stamina or mobility to evacuate quickly or endure long hours in uncomfortable emergency conditions. Even a sudden heavy rain or flood can disrupt travel, leaving older tourists stranded in unsafe environments. For older travelers, personal safety is a top priority. Seniors over 70 are often more vulnerable to crime due to slower reflexes, reduced mobility, and sometimes diminished awareness of rapidly changing situations. Countries or regions with high crime rates, such as violent theft, muggings, scams, or even organized crime, pose a significant risk to the health, safety, and well-being of older visitors. Understanding these risks is essential before planning any travel. Firstly, physical vulnerability makes seniors easy targets. Criminals often look for individuals who may not be able to react quickly or defend themselves. An older traveler walking alone in an unfamiliar city may become the victim of pickpocketing or mugging. Unlike younger travelers, seniors may struggle to escape or seek immediate help, increasing the chance of injury or trauma during such incidents. Even a minor fall or push can result in serious fractures, hospitalization, or long recovery time. As we age, the immune system naturally weakens, making seniors more susceptible to infections. For travelers over 70, visiting countries where infectious diseases are prevalent can pose serious health risks. Diseases such as malaria, dengue, tuberculosis, or gastrointestinal infections are not only more common in certain regions but also more severe in older adults due to slower immune responses, pre-existing health conditions, and reduced ability to recover quickly. Understanding these risks is crucial for safe travel. Firstly, seniors have a naturally diminished immune response. The body's ability to recognize and fight pathogens decreases with age, making infections harder to control and recover from. What might be a mild fever or temporary illness in a younger person can quickly escalate into serious complications for someone over 70. For example, a simple flu or respiratory infection can lead to pneumonia, hospitalization, or even death in older adults, particularly if medical care is delayed. Secondly, chronic health conditions common among seniors, such as diabetes, heart disease, or chronic lung problems, exacerbate the impact of infectious diseases. These conditions can make infections more severe and harder to treat. For instance, malaria in a diabetic senior can cause complications such as organ failure or dangerously low blood pressure, which would be less likely in a younger, healthier traveler. Even minor gastrointestinal infections can lead to dehydration, which is particularly dangerous for older adults. Thirdly, some infectious diseases are region-specific. Countries in tropical or subtropical zones often carry risks of malaria, dengue fever, Zika, and other mosquito-borne illnesses. Areas with poor sanitation may expose travelers to cholera, typhoid, or hepatitis A. Seniors are particularly vulnerable in these areas because their bodies cannot fight off these pathogens as efficiently, and they may not tolerate intensive treatment or hospitalization, as well as younger travelers. Vaccination is another important factor, but older adults may have weaker responses to vaccines, making them less effective. Even if a senior is vaccinated against common diseases, travel to high-risk areas may still carry a significant danger. Access to prompt treatment can also be limited in countries with poor healthcare infrastructure, compounding the risk. Moreover, infectious diseases can be difficult to detect in older adults because symptoms are often atypical. Seniors may not experience a fever or other classic signs of infection, leading to delayed diagnosis and treatment. This increases the risk of complications and severe outcomes. Finally, the psychological stress of traveling in high-risk disease areas should not be underestimated. Constant concern about infections can diminish the enjoyment of travel and create anxiety, which in itself can negatively affect immunity and overall health. Seniors need environments where they can relax, feel safe, and access reliable healthcare. If needed, for travelers over 70. Mobility is often reduced due to age-related factors such as joint stiffness, muscle weakness, balance issues, or chronic conditions like arthritis. While travel can be a rewarding and enriching experience, limited mobility significantly increases the risks associated with emergencies, particularly in countries that are unsafe, remote, or underdeveloped. Understanding these challenges is essential for seniors planning any trip. Firstly, limited mobility makes it harder for older adults to respond quickly during sudden emergencies. Natural disasters such as earthquakes, floods, or hurricanes often require immediate evacuation, while younger travelers may be able to run, climb stairs, or navigate rough terrain quickly. Seniors may struggle to keep pace, increasing the risk of injury or being trapped. Even minor delays in leaving a dangerous area can have serious consequences, especially in countries with underdeveloped emergency response systems. Secondly, medical emergencies pose additional challenges. Seniors are more likely to experience health crises, such as heart attacks, strokes, or falls while traveling. In regions with limited infrastructure, reaching a hospital quickly may require walking long distances, climbing uneven terrain, or navigating crowded street tasks that are particularly difficult for those with reduced mobility. Delays in medical attention can be life-threatening, highlighting the importance of choosing destinations with accessible healthcare facilities and reliable transportation. Thirdly, limited mobility complicates travel logistics in general. Airports, train stations, and public transportation in many countries are not designed with seniors in mind. Long distances, lack of elevators, poorly maintained sidewalks, or uneven streets can make routine movement exhausting and risky. In emergencies, these logistical challenges are magnified. For example, if a flight is canceled due to political unrest or extreme weather, seniors may struggle to reach alternative transportation quickly, leaving them vulnerable. Additionally, mobility limitations can make older travelers dependent on assistance from others. While this may not be a problem in safe and well-organized environments, it becomes a major risk in unsafe countries where help may be unreliable or unavailable. Relying on strangers, local transport, or unregulated services during an emergency can expose seniors to scams, crime, or unsafe conditions. Another factor to consider is the added stress and physical strain of carrying luggage or personal belongings. For seniors with mobility issues, even small obstacles such as stairs, long walks, or crowded areas can lead to fatigue, falls, or injuries. In an emergency, the inability to move quickly or carry essentials can exacerbate already dangerous situations. Finally, limited mobility affects mental preparedness and confidence during travel. Seniors who struggle to walk or move comfortably may feel anxious or stressed about potential emergencies, which can reduce their overall enjoyment of the trip. Constant worry about navigating unsafe areas or evacuating quickly diminishes the sense of relaxation that travel should provide. Traveling after the age of 70 can be deeply rewarding, offering seniors opportunities to explore new cultures, cuisines, and landscapes. However, language and cultural barriers can turn what should be an enjoyable journey into a stressful and risky experience, particularly in countries that are unsafe or lack adequate infrastructure. Older travelers may find it more difficult to adapt quickly, communicate effectively, or navigate unfamiliar environments, which can significantly increase their vulnerability. Firstly, communication challenges can have direct safety implications. Seniors may struggle to ask for help, understand emergency instructions, or explain health issues in countries where they do not speak the local language. Imagine an older traveler needing urgent medical attention during a sudden illness or accident. They cannot communicate symptoms accurately or understand a doctor's guidance. Treatment may be delayed or inappropriate. This risk is compounded in regions where English or other widely spoken languages are not common, and translation services are scarce or unreliable. Secondly, cultural differences can lead to misunderstandings or unintentional offenses, which may escalate into conflict or unsafe situations. Customs, social norms, and behavioral expectations vary widely across countries. Seniors who are unaware of these differences may inadvertently break local rules, draw unwanted attention, or become targets of scams. For example, in certain areas, appearing too affluent, dressing inappropriately, or not following local etiquette can increase the likelihood of theft or harassment. Older travelers, who may be less adaptable or slower to recognize subtle social cues, are particularly vulnerable. Thirdly, navigating public spaces and transportation becomes more stressful when language barriers exist. Seniors often rely on clear directions, maps, or signage to move safely. In countries where signs are in unfamiliar scripts or public announcements are not in a widely understood language, getting from one place to another can be confusing and exhausting. This difficulty is heightened in unsafe areas where moving quickly or confidently is critical to avoid crime or hazards. Even routine tasks like ordering food, purchasing tickets, or asking for directions can become sources of stress and anxiety, which take a toll on both mental and physical health. Moreover, language and cultural barriers complicate interactions with local authorities, medical personnel, or emergency responders. In the event of a natural disaster, political unrest, or crime, clear communication is essential. Seniors may struggle to advocate for themselves, report incidents, or follow instructions, putting them at greater risk. Even simple misunderstandings, such as misreading a safety sign or misinterpreting instructions during an evacuation, can have serious consequences. Additionally, the cumulative effect of language difficulties, cultural misunderstandings, and stress can reduce confidence and independence in older travelers. Constant worry about offending someone, getting lost, or being unable to communicate effectively can create anxiety, reduce enjoyment, and even impact physical well-being. For seniors, this stress can exacerbate heart conditions, elevate blood pressure, and increase fatigue. Traveling after 70 can be one of life's most enriching experiences, offering opportunities to explore new cultures, enjoy beautiful landscapes, and create lasting memories. However, the health, safety, and comfort of older adults must be the top priority when choosing a travel destination. Opting for countries and regions that are senior-friendly ensures that seniors can enjoy their trip without